If we are trying to raise a generation of competent future nurses, then these are things that we must put into consideration. Please watch this video to the end, share, and also follow me. First, future student nurses should be taught strong clinical thinking and not just cramming. Here is the issue that we are mostly facing today in this profession, because some people basically cram without understanding. They don't ask questions like, what is happening to this patient? What is the priority here? What can kill this patient very fast? These are things that we need to think about, we need to inculcate into the upcoming generation of future nurses so that we don't cause trouble in this profession. Second is early exposure to real clinical scenarios. Now, students should be exposed to much of case studies, simulations, and real-life events, not just theory. Theory is not enough. The earlier they are exposed to these clinical scenarios, the sharper they become. In order to keep building this profession, future student nurses must be taught prioritization and decision making. This is a very integral part. They must be taught prioritization and decision making. Now, this is how you apply this. When you're exposed to a critical situation, you must ask yourself, what is the priority? What should I do first? What should wait? And what should I start doing right now if this case is life-threatening? Because this is where it all matters. As a student nurse, you should know about priority and safety. Priority is things that you should focus on doing first in order to make sure you stabilize the patient, while safety is things that you're going to do to prevent further harm from occurring. So it is paramount that student nurses are taught priority and decision making. Now, the fourth thing is communication skills. Lack of communication or improper communication in nursing can ruin a lot of things. When a nurse fails to communicate properly, when you don't know how to calm anxious and nervous patients down, then there is risk. If you don't know how to report properly, then you're putting your patients and the relatives or whosoever you are dealing with at risk. The fifth one is emotional intelligence and empathy. While we were in school, we are taught that nursing is all about caring. Now, this is very, very accurate, because when you're working in the real world, when you start working, you're going to understand that empathy is actually the basics in nursing. As a nurse, you have to stay calm under pressure. You have to learn how to act and deliver your job without losing professionalism, because patients remember how you treat them faster than what you do. Another thing is also confidence. As a medical professional, you have to be very, very confident. Even though we know our patients' rights, you as a medical professional should know your rights. You should always try to consult your co-workers. When something is very unclear to you, don't act like you know it all. Try to reach out to your superiors, try to reach out to your head nurse, your charge nurse, whosoever is handling or working that shift with you. Try and do all of these necessary things. So if we don't fix this now, we'll keep producing people who pass exams but panic in real clinical situations. Please share this video.